How individuals adjust or adapt to stress can vary from person to person, situation to situation. We'll talk about the role that telemedicine and virtual physiotherapy can play in mitigating psychosocial hazards in the workplace. Up next on this episode of the Psych Health and Safety USA podcast.
From Flourish DX, this is the Psych Health and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each episode, we look at psychological safety from an occupational health and safety perspective. Let's talk Psych Health and Safety.
Welcome to this week's Psych Health and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Each week, we seek to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, and advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. This episode is actually the first in a series that'll focus on the various ways that people cope with being exposed to psychosocial hazards and the associated stress. Specifically, we'll talk about telemedicine and virtual physiotherapy. So traditional approaches to physical or mental health care require either a house call by the provider or a medical facility visit by the person needing care. But that's changed a bit over the last couple of years, particularly in the aftermath of the COVID-19 pandemic. And we've kind of accelerated the acceptance and use of telehealth and opportunities to talk both with mental health care providers and even now with some physical types of care can be done virtually. And there's a lot of benefit to that. And again, we're going to have just, some great conversation that way. This will also be a conversation with someone who already believes that psych health and safety is a thing. And that's really important for me. It's really the goal of this podcast is to get people to see that psychosocial hazards are real and they have an effect in the workplace. They have an effect in lots of other places. And so it's good to get someone that I don't have to convince from that perspective. And hopefully we'll also get into some practical strategies that both employers and employees can use to implement some strategies to address this entire conversation about psychological health and safety. So let's start with an introduction from my guest for today with this question: who is Dr. Jim Feng?
Wow. Thank you for that introduction, Dr. David. I'm so glad to be here. My name is Jim. You guys can just call me Jim. And I guess I started my career in the health field about 14, 15 years ago now. I was working with high performance athletes. My background started in strength conditioning and then moved towards the sports-based chiropractic care. And what I did was, I guess back in the day, I was building out integrated clinics as well as servicing high performance athletes. So I was working with the national wrestling team as well as the UFC, and not only taking care of their injuries, but also working on prevention. So there's a lot of behavioral economics and how we instill knowledge and knowledge transfer, as well as for getting them out of pain, but also how do you stay out of pain, right? So for a lot of my career, I was working one-on-one with patients as well as groups to distill down. And for us, at the end of the day, it came down to not just the stuff we can do and touch. Like there's hands-on stuff we can do for myofascial releases, like active release, and also adjustments or movements and mobilizations and different, modalities in regards to like maybe laser therapy, all that. But when it came down to it really comes down to the actual movement component of it that really got people better and kept them better, right? If you build a better foundation, not only are you physically, you have a better resilience, but also mentally you have a lot more resilience, and your level at the ceiling is significantly higher. So, working with those athletes, I would say they're relatively easier. I mean, they're kind of bona fide in their sense of, they're kind of putting themselves on the pedestal, but they're a lot easier to motivate in regards to doing the thing, right?
Mhm. Right,
So,
right.
but I guess working on the others, yeah, I guess working on the other side of things. Now we have to work with the public system, working with disability, based patient, working with employees in the workforce that don't necessarily want to be back and or less incentivized to do better for themselves. So how do we get Joe Sixpack to do the same thing? Right?
Mm, right.
It's a lot harder. It's a lot harder. And I found I really wanted to tackle that problem because that's the majority of the population, I would say.
Right.
You have the high performance guys up here. The really low guys are down there. They're really hard to deal with. I think the middle bit, I think we can do a lot more. I think do a lot better for them. Providing better systems around knowledge transfer, and a lot of times, in clinical practice, it starts with it's really revolved around the practitioner, the solutions and the tools. However, I think our system is missing the whole patient central. It really should be patient based, and we really need to do better by them to engage them because they're the people who are putting the strain on the healthcare system. And it starts with prevention, which is
Yeah.
one of the hardest thing to do, as you know.
Absolutely. Absolutely. Well, interesting. You'd mentioned that you'd work with the national wrestling team. I wouldn't have been one of the really high performers, but, I did some wrestling actually back in high school and did some coaching. So have some, and still really enjoy a bit of a rabbit trail here. I had opportunity recently to attend a high school reunion and got a chance to sit down and have some conversation with my high school wrestling coach. And it's been way, way, way long since we've even seen each other. But it's an interesting discussion about the difference between the folks who are fairly easy to convince that this is a good thing because of their athletics and their competition, and then the average person who sometimes really doesn't see the connection. So, but before we dive really deep into that, another question I ask everyone who comes on is, when you hear psychological health and safety, what does that mean to you?
And that's a great question, and I was preparing a little bit for that before I came in, and we've had the opportunity to work with many companies in reducing injuries in the workplace and distill down preventative models of care. And a large component for me is getting that lazy human to do something that they don't understand, first of all, right? There's a big knowledge transfer as to what it is they need to do. And then also to continue on and do the thing and understand that they're getting better as, in regards to resilience and, strength, that'll be strength or mental health. And I think the psych component of health and safety is really understanding not only your physical self, but your environment around you, right? And really understanding that these are the occupational things that are a massive hazard to you if you don't do it right. So
Right.
It's funny because one of my clinics, my brick and mortar clinics, are called form and function, right? Health, performance, wellness, but form and function are the key. So number one is work on your form. That means how to lift the item properly, how to put yourself in the right environment. So there's the stuff that's around you are not a deterrent to you, and it's not an issue that's going to cause more problems around, injuries and what have you. It could be psychological, it could be physical. And then also function in the sense that building your resilience. How do you actually, build knowledge transfer? So you're doing continuously doing the right things, and also understanding these are the good processes and not to react, and to be more mindful of your environment and what you do to make sure you're safe, right? And safety comes in many forms and factors. It could be repetitive in nature. It could be very acute in nature, be gaseous. It could be, the mental health component of it, the longevity of your work and how to be at the highest level of performance. And I really truly believe in when you're physically healthy, you have endorphins and kephalons and you're in mitochondria are firing, and you have a lot more energy to be psychologically healthy. And then you're going to be making better decisions along the way. So it really ties together, and it's not one thing, as you know, it's biopsychosocial and environmental.
Right.
And we have to really create a system that really not just measure that, but also how do you continuously drip that information that's nuance, and that's very similar to taking action in regards to like TikTok infinity scrolling, but do the same thing for your physical and mental health.
Okay. Right. Okay. So let's dive into the discussion du jour. And as I shared with you before we came on, I don't know that I'd even heard the term physiotherapy before, so I kind of looked it up a little bit. So for other folks like me who don't even know what is physiotherapy?
Yeah. I mean, physiotherapy or physical therapy, they all mean the same. It's really the rehabilitation using tools to get your physical body in a better place. Now, physical therapy has many different realms in what it is. There's rehabilitation, there's vestibular, working on balance, there's pre and postnatal that you can do. There's orthopedics, working on the joints. There's post-operative for different cardiovascular. So there's many realms to the physical self, and to get people better. And so, yeah, I think when it comes down to it, it really comes down to how do you stimulate the body to heal. And that's either external stimulants. It could be a combination of hands-on therapy, like very specific, myofascial release, like getting into those trigger points and releasing tight muscles or injured muscles, to, adjustments or mobilization of the joints, to work on the joints, to relieve them, to be able to open up the joints a lot. And then exercise to build resilience around the human body. So building muscle, building function, right? Building balance, building stability. And, many of these things we lose really quickly over time, especially after age of 40, you have 3 to 5% declining strength, right? Per year. Wow. And if you don't work on these things consistently to maintain your aesthetic decline, right? I mean, we're only meant to live for 30, 40 years, about a couple hundred years ago. So, but, medicine has changed since. So the physical therapy is just that. And our job is to empower the individual to do so. And I would say majority of the gains, if you look at the research, is how to train the body. It's not much different than, train to gain muscle, training for, states, for, in regards to wrestling, teaching a skill. It's very similar to that. And, you get better, practice makes better, practice makes permanent, I guess. So practice better make to be better. Very similar concepts. I like to say hormesis added a level of stress to a system for the system to change for the better.
Okay. Honestly, as you described that, I didn't realize that physical therapy and physiotherapy it sounds like it's versions of the same thing. So that's very helpful to understand. So how would yeah? So how would you make the connection? Because there's a lot of conversation about all things physical. How important it is, and whether folks do it or not is a whole different conversation. But there's a lot of discussion about we need to keep our bodies in, shape, and if we don't, the things that can happen. So how do you make the connection between physiotherapy and the emotional state of the person or individual?
Yeah, great question. So, for me, when we started Fhyxable was back in 2017. This is even before COVID, obviously. And I just realized, hey man, like if I can get these individuals in person to do the right things, and whether in the clinical setting, and then how do I get them to do outside the clinical setting? Because at the end of the day, when you see me, it's really expensive, and you see our practitioners in the clinic, it's truly expensive. But when they come out of those sessions, say on average for a musculoskeletal injury, they come in maybe once or twice in a week, right? Max, if they're really bad, maybe 3 to 5 times, depending on their coverage, but they still have a limited amount of coverage, right? So there's like, how do you incentivize them to start and finish and prevent? It's really, really difficult. So we really built Fhyxable around prevention, but we had to start at pain. And how does that, by getting them to move, it was easy to, in person, to really engage them to do that they need to do their work when they're right there. I can coach you along all day long and get you moving, right? So,
right.
But when they're outside my clinic. And when it comes down to, gains, just like you working out, trying to lose weight, you working out, trying to gain muscle, how are you going to do that once or twice a week? Like impossible, right? You're just maintaining. It's like, it's really, really difficult. How do you run a marathon training once or twice? No, you got to be on top of it all the time until you're good. And then you can get to a bit of a maintenance or supportive dose, right? So with that being said, I really wanted to create a system and, a model of care where we're able to reduce the cost, number one, and also be implementing solutions at home to get them moving. And part of the issues previously, when your practitioner would give you a piece of paper where your list of exercises was that you take that thing home, it's like 1 year out the other, you're not getting to it. There's no incentivization to do it unless it hurts that much. And then also, are you doing it right? And are you getting better over time? So I think the psychological component and for us, a lot of our product designing, product development, it's all around the psychology of that human. It's user research, and it's the component of understanding the patient journey. It's road mapping, right? Of how they use the platform, why they use the platform, what incentivizes them to come back, and what incentivizes them to finish, and what incentivizes them to do more for their health. So I really dove down deep, and I love this podcast because it really comes down to the psychology to lift the finger, right? To do the better thing, to do the important thing. And it can't just be, I told you so. It has to be more intrinsic, and there needs to be some kind of extrinsic motivation to get you started, but it really needs to dive down deep on the intrinsic motivation level to get that person to continuously do the thing. It's not like taking medication. It's much harder than taking medication or maybe even stopping and doing some breathing techniques, right? Like it's a lot more difficult. It's not a one-time transfer. It's a continual transfer, and you have to progress with your sets and reps on the exercise and movements and knowledge transfer. So it's a lot more difficult than your typical interventions. So how do I get this person to, continue and progress? That's really what it came down to. And I thought to myself, hey, if I can get this lazy person on the other side, and we're all lazy, by the way, it's just not everybody. I'm lazy too. We don't want to expend energy if we don't need to. But if I can get that person to lift a finger continuously to do a physical thing they're not used to doing, which requires a lot more energy and sometimes equipment and space, then I think I can do it for everything else. I think I can do it for mental health. I think I can do easily for nutrition. I think I can do easily for, even speech therapy and everything else in between. So we're starting to see that with a few other interventions. So we started in the physical health realm. We saw really good success. We're kind of moving towards a full integrated platform. Recently, we have a massive project with the Canadian Space Agency, which is they have a partnership with NASA as well in regards to Artemis. A bigger topic, maybe we can have to if we have some time.
Right.
Yeah.
Right. Wow. So again, it sounds like you started off with this, observation that, when people are around you, it's kind of easy to get them motivated, but what do they do when they're outside of your, they're not sitting in the office, they're not, sitting in a session. And that actually makes a lot of sense that, many of the things that we do, if we're relying on motivation from somebody else, external motivation, they're only going to last as long as we're being externally motivated. As long as we're around the other person. And a lot of that, how do you build that internal need and observation? Well, that observation that I have a need to do something for myself, because, Dr. Jim and the folks can't fix this for me if I don't do anything on my own. I mean, you can't, wave a magic wand. I guess it'd be nice, but I don't think it's quite that easy. So what have you seen in terms of the drivers for people? And you talked a little bit more about, about pain, and sometimes that's an interesting conversation that sometimes that almost becomes the motivator that, to reduce my pain. I realize I'm going to have to do more than just go see this guy a couple of times a week. There's some things I have to do myself. I believe that same observation or that same situation occurs for people that are having emotional kinds of things going on with it. It doesn't feel good to me. I've got to do more than just show up and see somebody a couple of times a week. I've got to change how I live my life. So talk a little bit more about maybe, some experiences or opportunities you've seen where, what is it that's driving people to do that when otherwise they wouldn't?
Uh, no, that's great. And we have a couple tips and tricks, but um, everything along the way is important. So even in clinical practice, we have these outcome measures, right? Things, a typical one would be a VAS or visual analog scale, right? So real simple to do kind of one here, middle of the treatment plan, and maybe at the end, right? But the patient doesn't see it. They don't know if they're getting significantly better. And you only see them ever so often, but hey, where's my actual trend lines moving? Am I getting there? And at what point do I need to stop, or do I need to maybe change my program and progress? So like even a basic health score, right, kind of shows that individual, okay, I'm incrementally better. Maybe in the yellow, I need to get to the green, right? Real simple thing like that. So I know where I am within my journey. Right. And then now you can kind of compare it to normalcy as to what normal kind of looks like, because many people, they're siloed, right? Their health information is very siloed. I don't know what's going on with myself. This is my journey. This is my history and my experiences. And, as you talked about lived experiences, that's really important because everyone brings different baggages to the table.
Right.
But this is what the mean looks like and what you should be able to do. Right? Here's a double I squat, and this is the perfect position for it. We use things like machine vision to gauge those things as well, so you can see how you're getting better over time. So real-time feedback, right? So we use really cool tools in regards to capture that. We also have some artificial intelligence at the back end that's actually distilling that information and progresses you stepwise progression that's personalized for you. So that's really important too. To personalize the solution for them. It's not just tech. It's personalized support. It's a co-pilot along with your practitioner support. The other thing is just great notifications. Like what it should know, your system should know, hey, when do I have time to do this? We're really experimenting with AI right now to give dynamic type of notifications to do in the real time. So for instance, basic things like even tracking glucose monitoring, like we're actually creating programming around that to actually stay within range for longer. So on a preventative standpoint, and that requires artificial intelligence, your movement, history and how you're moving, connected devices, and such, and to poke you at the right time when you actually don't have as many things blocking you from taking that step. I'm busy with work in that time. It should know that, hey, I'm busy with work. Don't bother me, right? Versus, this is the optimal time I typically work. I can do this, right? Or implement it throughout the day. Right. Things like our basic programs, like our posture program. We have like a really cool posture program that just like you can implement throughout the day, right? So little things like we're sitting here for the next for an hour or what have you. My posture is not the greatest. I'm creating creep, a lot of compression on my discs, right? My joints are getting, thinner and thinner as it's losing hydration. So I need to move. Motion is lotion for the joints, right? So it should know within time to, hey, pinpoint, chin tuck, shoulder back, do a quick little burger stretch, get back to work, right?
Right,
so,
right.
Couple deep breaths, for the psych side of things, to get your anxiety levels down when you're in a project and refocus. And we also know basic things like in our posture program looks at the undulation of your ability to focus, right? So 90 minutes, your probably attention is gone. So before that, you should be taking a break and really clear your mind, and then getting back. And what's a perfect little stretch in between there to get back to work, right? Things like that, smart little things that builds those little tiny wow moments, a little dopamine hit, little serotonin reward that gets them back into the application. Also makes the process a little bit more fun, and the little snacks, if you will, health snacks, actually builds over time, and it becomes a large meal, right?
Hi listeners, Jason here. We hope you're enjoying this latest podcast episode. Now, if you're like Joelle, Alicia and myself and enjoy learning from the best, then the Flourish DX Academy is for you. The Academy includes free e-learning courses on the ISO 45003 standard for psychological health and safety at work, and associated topics such as how to conduct a psychosocial risk assessment and how to create the business case for psych health and safety. All courses feature high-quality videos, downloadable resources, multi-choice questions, and a downloadable training certificate on completion. Take your learning to the next level with all Flourish DX Academy courses included within the Flourish DX mobile app. Select podcast episodes from the Psych Health and Safety podcast and sister podcasts from Canada and the USA are also included. Get started with FlourishDX for free at www.flourishdx.com/get-started. That's www.flourishdx.com/get-started. Now back to this episode.
Right. Well, I really like the approach as I'm listening to you. Again, the connection they make is, it sounds like you're trying to help people develop this motivation where they already are. And again, not assuming they're the high performing athletes that you dealt with before, because they're not. I mean, and because I guess I've seen a lot of approaches to all kinds of things. And it's really great they're having a conversation around something that's tangible. People's physical, people tend to know a little bit more about that. But I'm observing that the difficulty that some are having with their mental health is simply an indication of what they're doing with their physical health, because they're not doing well there either. And I'm not really into binary choices. It's not either or. You have to have both. You will not be strong mentally if you're not strong physically, and you won't be strong physically if you're not strong mentally. You can't I'll just be one. You have to have them both. And so I just really like this approach that wherever you are, you can get further than where you are, because you don't necessarily have to become a pro athlete overnight. It's just a great approach.
That's right.
Yeah.
No, those are great points. And we also struggle on the physical side to sometimes even get the person from 0 to 1, right? How do you get that individual who's in chronic pain, disabled, don't really want to go back to work and don't want to support, the ecosystem, and only thinking one path, right? But at the end of the day, they're losing money sitting on the sidelines, wasting their time, and there's no progression. And at the end of the day, when you pass, is that the thing you want to do, right? And so how do you get those individuals psychologically fit to take the first step? That's difficult sometimes for us, right? So I really like the approach on that, on the psych side of things, to even get that motivated. And on the opposite side of the coin, I find those people who are truly, have never done the physical side of things, and also have depression and, have many other blockers on the psychological side of things, that taking the first step of movement, as you mentioned earlier, drives energy, man. It drives energy to get you in a psychological state, at least to, hey, I want to lift a finger, right? I want to do a little bit better for myself. And you start nipping away at these problems, right? Being psychosomatic, or being, fully physical, or being overweight, nutrition, being in your environment, understanding, trying to learn, whatever that is, right?
Right. So I again, as I'm hearing the definition, the description of, physical therapy and such, it's easy to imagine, someone going into, the clinic and, getting on the treadmill, or using a band, or lifting a medicine, whatever it is, doing some things. Yeah. So share something about how you do this stuff virtually. That's interesting. There's a part of me that thinks, well, I'm not surprised that I could talk to my therapist virtually, but how do you do the physical stuff virtually? So talk a little bit about that.
Yeah, that's great. And the reason why I started on the physical side of things is I know it best. Again, I came from a background of wrestling. We're really physical. And again, I wrestled 15 years. I coached as well. So it's definitely my realm. And so the physical side I knew really well, and I just understood that we can do the other stuff after. And that's what we're doing now. We're kind of just creating the platform for other practitioners to be able to use, healthcare systems and even workplaces to kind of tune in, and also, different practices from, family physicians to be able to empower their patients to start utilizing the platform and the services. But, the physical side, I thought was going to be the hardest side. But then again, what I looked to really for encouragement was the Jane Fonda videos. Remember Jane Fonda back in the days?
Yeah, back in the day.
Clamshells, man. So I really looked at that, old school, all the strict Stratus yoga, DVDs. And then now, of course, you have everything from Peloton to every exercise app, left, right, and center, right? That can get a human to move and do it for what purpose? Vanity, right? They're looking for vanity. 80-90% of the time. And I was from the conditioning coach prior to being a practitioner. And I've seen, probably hundreds of thousands, probably a couple thousand of clients trying to get them, looking good, feeling good at the end of the day. And then, but on the other side is like, there's like physical therapy really it's a spectrum of care, right? So it can be as, as bad as like a post-operative full knee replacement or hip, or this guy just compound fracture, got to get him moving, his toes moving, everything else, or major neurological deficit and work there. It can be as, far-fetched as that. But on the other side, the spectrum is prevention. I feel like the exercise portion, you should tie some of the vanity in, and it's okay. And I think healthcare systems should pay to some degree to be able to get here, because the stronger, more resilient you are here, the less likely you're going to be on the other side.
Right.
You know what I'm saying?
Right.
You're building a better foundation, stronger foundation, more physically and mentally fit foundation. So you're less likely to slip and fall, as a senior. You're more likely to catch yourself on an odd place. If your core is nice and tight, you're less likely to hurt your back. If you understand how to bend forward properly, hip hinging properly, and and not just fully loading your knees, then you're gonna, resolve issues in your back and your knees. Like, those are the form and function, components you should be doing along the spectrum, right? So how do you do that physically? So if you looked at P90I, same concept, no different, but the main thing is also along the path is that I want to implement outcome measures along the way. So within the program of care, we have exercise, like thousands of pieces of content videos to teach you, right? There's educational pieces, there's exercises, there's things for occupational therapy, physical therapy, mental health components on there as well. There's all that content to kind of teach you. The sets and reps are built in as well. There's, machine learning on the back end that's teaching you in regards to how you're progressing over time. We're implementing some of the things as we go. And then we have subjective measures along with questionnaires specific to the ones that are embedded in the best research for the common issues. And then we also have teamed that up with the practitioners asking the questions during virtual sessions, right? Those are the things you're able to, kind of monitor yourself along the way. We're also embedded machine vision, I kind of alluded to earlier, and as well as wearable device data to know that objectively you're getting better over as well. So cardio rehab, your heart rate, O2 monitoring, like all that stuff is all embedded, right? So we're doing this for astronauts, and they'll be ready for our general population very soon as well.
Wow.
So that whole system should feed back into the system. So it makes my life as a practitioner easier, that I know this person's progressing nicely along the way. And then when they see me, we're reinventing solution. I'm encouraging them to progress, and there's like nuances of knowledge transfer I still can't get to, which is content, right? There's still that human practitioner connection, and we still found our programs work a lot better with the virtual care. So we have a whole virtual care platform specifically made for movement. So we have specific tools in there to look at pre and post. We have specific tools in there specific for movement, so we can gauge how they're moving and progressing over time, and as well as like dynamic chat systems in there. So instead of so in regards to health data, we have a lot of AI in the back to feed that health information to the top. That's most important. More to come there.
Right.
But so a lot of little tools that you're able to, not just another YouTube video, if you will, but a progressive manner in how to get people better over time.
Right.
And as well as live sessions or group sessions to really, to showcase and give feedback to the person so they know that the little questions are answered, basically motivation's there.
Right. Yeah. Again, just listening to your description about how the process works, physical injuries can be psychosocial hazards in and of themselves. I mean, similar to what happens with an athlete, they pull, tear, stretch, something, doesn't feel right. They're not going to perform as well because they can't, they don't think, I'm not sure about that knee. I'm not sure about that shoulder. I'm not sure about whatever it is. And their performance is affected by they're just not sure. And physically, it may actually be better, but because they don't know, again, you talked about the advantage of providing this data along the way. So the person who's been injured, you can see that it's getting better. And That's a very interesting kind of concept because, again, my belief is a lot of folks get tossed. So they get injured at work. They get sent to to a clinic or to a doctor, whomever, that never really tells them what's going on with their own body. So I guess I feel a little bit better, but I'm still thinking about that injury that I had and how I got injured. I'm not sure if I'm ready to go back to work because I just don't feel like it. I mean, emotionally, I don't feel like it, even though physically I might actually be better. So it's a very interesting discussion about giving people data so they know they're getting better. And the employer knows as well. That's probably a benefit. But I think it's most important that the individual, you have to know you're getting better. And that's, some of that's in your head. Wow.
Yeah,
Wow.
absolutely.
Wow,
That's a big component of all this. And, the health data is really important for me as a patient, and we should be the custodians as a patient of our health information. And we should have all the little piece of health information. I should be able to access that anytime, and I should be able to understand it at any time. That's really important too. Not only is it there for me, I don't have to go jump 1,000 different places for it, but I should be able to understand it. So we're creating solutions around that right now, and it's about to be deployed. And you're going to be the custodian of your health information. You're going to understand it so you can make better decisioning, and they can find the right support to help those little parts of your health that's not working for you. Right.
Right.
So all of that is extremely important. And we're developing some of those for the Canadian Space Agency, as I mentioned. So see some really cool stuff out in the media real soon. But overall, we that health information, there's a broad standard. There's a global interoperability standard that they've created. We're creating one here up north in Canada, and that will distill down. It's global anyway, so you'll see it in you see it all in Medicaid and all the EMRs right now. So you'll hear something about FHIR HL7, standards of health information. So we're actually building a really cool solution that will be a middleware for a lot of companies that don't have their health information in the right solution. And then and then on Fhyxable, you'll be able to visualize it for yourself to take incremental action for prevention. Yeah.
So I tend to describe myself as a bit of a futurist. You can be a futurist one of two ways. Either you can go get education and the certification and all that type of thing, or you can call yourself one, and I chose the latter. But so take me a decade down the road. We're going to do a little bit of, sci-fi here for a second. Where do you think we are, say, 10 years down the road with, this whole, you have access to your own data. You're able to track what's going on with you in a lot more objective way. How do you see things being different, to include how that might affect our healthcare system? Because a little bit of caveat before you answer the question is, I believe that our current healthcare system around the world is really too reactive. I mean, we spend goo gobs of money trying to fix things after they're broken, both physically and mentally, after they're broken, and not a whole lot on the prevention side. But even those who want to prevent don't have real data to be able to do it. So where do you see us, 5 to 10, or maybe you have some sense that it'll be within X number of years you see. So take us on that journey for a couple of minutes.
Dr. Daniels, you nailed it on the head, man. Our system it's not a healthcare system. It's a disease care system, period. Like all around the world. I mean, there's a handful of, countries that do some stuff on prevention. We have it in our system that do some prevention, but none of which are incentivized enough. And there's a whole big pharma play here, of course, in regards to how we're able to remedy problems. But if you look at, the healthiest people in our population, if you look at all the major disease states that causes morbidity and mortality, they're fully affected by lifestyle changes. They're fully affected by what you do with your body, what you do with your mind, and how do you, create a better resiliency for yourself. We're human bodies. I mean, I'm not super religious, so I believe in evolution, and I also believe in higher being. But our bodies evolved to this state. Our mind has evolved to this state. And our jobs are getting cushier and cushier. We have way more food than we need, and now we have like a lot of food is actually a lot of calories or crap calories. All of these problems, and you have a job. We're sitting right now, and we're in a desk all day long, 12 hours, 16 for me, but that's causing a lot of disease states. So how do I incentivize that human to do the right thing, prevent? I think that's really important. I think setting baselines and understanding, where you are in regards to your health state is really important. So future 10 years from now, I see a system, and I think all these, tracking devices, I'm just holding up my Apple Watch for those who are not watching, but even our wearables that we've created, and, blood glucose monitoring to every component of monitoring of all your health information should be in one place. But more importantly, it's for you to understand where your level of state of health is. If I can't measure it, I cannot manage it, right? It's very difficult. Right. And some people, like for me, I have this, like they call it synesthesia or whatever you want to call it, but like you have an understanding of how your body feels relative to where you are in regards to health, right? So I know after a good workout, I know within about 8 to 10 minutes of a good HIIT session, I can get those endorphins pumping. I'm really feeling that energy level. So there's that state of that. And I kind of know now with the blood glucose monitoring system, I actually monitor for performance. I can't see it here, but it's underneath. I don't have diabetes, but I'm monitoring for our systems. And I know how I feel when I eat a very high carb diet first. And over time, I get a good feeling of it. And then also you learn from it. Hey, I can now put meats and veggies in between and then I get a less of a glycemic jump, and my glucoses are a little bit more stable. And if I do like 15 squats throughout the day, I can keep that in base, so I'm in range for longer. It's like you get a natural feeling of it. I think you can create like digital doppelgangers on to what that looks like to visualize on an iPhone or what have you. But you should be able to understand what that looks like. And then our system, our healthcare system, and some practitioners are moving towards that, is, setting up the nuances of the engagement component for your patients to do the right thing. When you're diagnosed with low back pain, diagnosed with diabetes, you can't just tell the person to go home and just work on your diet and work on exercise. Right. The hell does that mean? What does that mean? What do I do on a daily basis? How do I measure this thing? Right. If you're pre-diabetic, it's a good inkling, ring the bell. Hey, buddy, get on a specific program. This is how we measure it. And it's not one-time measurement in 6 months. It's continuously being monitored and doing the right thing. So you get the gauge right for you, right? And this is what I can do, at least minimal viable dose of exercise and eating the right thing, what to eat, culturally, reliable as well there. So I think prevention is totally key. And that's literally a premise of what I came into this game for, is work on prevention. And sadly, it's really difficult because there's no funding in it. It's very minimal amount of money put towards it. No mandates around it. No one pushes for it. Right. And, but I think for us, you can start with pain. For us would be physical pain, right? For you, maybe, depression, psychological pain, or just not being in a really good place. And you start there, but just understand the intervention. When you stop the intervention, it's not to stop when the pain is gone, not the problem is gone. You got to create leveling. You got to level that human up. Just like evolution, you need to create better levels of states for yourself, right? As a wrestler, I'm not going to go and just be like, yeah, I'm just decent, right? If you want to be an Olympic level wrestler, you better be training 5-6 times a week. Great nutrition program, great recovery programs, and, meditations, everything in between. You don't have to get to that level for a general population, but you know what? You need to level up 1 or 2, right? And if we can do that and your outcome measures based on that, I think we'll be a healthier society.
Right. Wow. That's actually kind of inspiring. It makes you feel like you want to go do a workout. But
let's do it.
So as we start to wrap up the conversation, there may be those who who have been listening to some of the things that you've said and says, wow, that sounds like a lot. It sounds like but I actually want to learn more. So how do you engage people? How do people find you, reach out to you, have more conversations about this topic?
Yeah, absolutely. You guys can hit us up at info at Phyxable.com. So info at Phyxable, Phyxable, like a physical fix, Phyxable.com. So you can definitely check us out, and you can go to Phyxable.com to check us out. We're pretty active on LinkedIn as well. So feel free to reach out there. On our Twitter, all the social handles at Phyxable. So
Right.
check us out there. Yeah.
Right. Absolutely. Well, Jim, it's been a pleasure to get to meet you, know a little bit about what you're doing there, both personally and at Phyxable. I guess I'm looking forward to seeing more. There was a time I thought I wanted to be an astronaut when I was a kid, until I figured out the drinking Tang and having to float around. It turned out maybe not so much. So maybe not so much. But yeah, that sounds. Again, it does sound encouraging, though, that we're kind of on the road. And again, I'm with you. I realize that there isn't a lot of, buzz and funding and all that type of thing around prevention, but I think it's got to start someplace. And I think there are those of us, that believe that if we continue to help people understand, you're actually, some people don't do the prevention because they think it costs more. Well, the reacting costs a hell of a lot more than the prevention does. I mean, it just does. I mean, I've told folks from an occupational safety and health perspective, I can generally go to an organization and not cost them a dime because they're wasting tons and tons and tons of money right now doing things that if you did a couple of small tweaks, you wouldn't have to spend money on that.
That's
you really
right.
wouldn't. You wouldn't have to spend money on those kinds of injuries, and certainly not, losing, folks, in terms of serious injury or fatality. You wouldn't have to do that if you did a couple of tweaks. So I really like the discussion that you're having about giving people information. Those who want to get on that road, they can have some objective data. And while they can certainly have folks like you around to advise them, you can't be all things to all people. You can't follow everybody home. So
Yeah, that's right.
yeah, absolutely.
That's right.
Absolutely.
But
So again, thanks very much for spending some time with me. And if you who are watching on the Flourish DX YouTube page, this is the first time, thanks for joining us. Please do like, subscribe, and share. If you are listening to the podcast, wherever you get your podcast, again, welcome. I hope something that you've heard will help you and convince you to come back in the future. The previous episodes of the podcast can be found at psychhealthandsafetyusa.com. Please do become a part of the Psych Health and Safety USA movement by connecting to us on LinkedIn. And we'll look forward to hearing from you and seeing you next time on the Psych Health and Safety USA podcast. Thanks very much.
Tune in each Friday for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to David at id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.